Health spending rose just a bit, by 3.7% in 2012, and while the White House tried to take credit for putting on the brakes, it really looks more like plain old economic cycles, government actuaries reported Monday. The latest look at what Americans spend on medical care shows prescription costs fell as blockbuster. Money-making drugs like Lipitor went generic, but health insurers paid a bit more for hospital care. Actuaries Actuaries for the Centers for Medicare and Medicaid Services found Obamacare's role none at all. They found something the White House strongly disputes. Their report, published in the journal Health Affairs, found that health care spending in the United States grew at a rate of 3.7% in 2012 to 2.8 trillion US dollars. The US spent 8,915 US dollars per person on health care in 2012, or 17.3% of gross domestic product, more than in any other developed country. We see that health care spending increased 3.7% in 2012, which was the fourth year of relatively low and stable growth, said Micah Hartman, one of the experts who wrote the report. The rate has been relatively steady since 2009, the actuaries wrote. This means that growth during all 4 years has occurred at the lowest rates ever recorded in the 53-year history of the national health expenditure accounts. Spending went up a little in some places, but it was offset by reduced spending in others, said Anne Martin, an economist in the office of the actuary at CMS, who led the study team. For instance, Americans spent 4.9% more on hospital services in 2012, or 882 billion US dollars, and 565 billion US dollars on physicians or in clinics, 4.6% more than in 2011. And despite widespread reports that Americans have been spending more of their own cash on health care, out-of-pocket spending grew just 3.8% to 328.2 billion US dollars in 2012. Spending fell 1.6% on nursing care and in continuing care retirement communities to 151.5 billion US dollars, and spending increased just 0.4% on retail prescription drugs to 263 billion US dollars, due mostly to expensive brand name drugs becoming available generically. Generic versions of the cholesterol drug Lipitor, the asthma drug Singulair, and the clot boosting drug Plavix all became available in 2012. The White House said it was all due to the 2010 health reform law. While there is a debate about how much the Affordable Care Act has contributed to this health cost slowdown, there is no doubt that it reduced Medicare spending growth, and most experts believe that Medicare savings spill over into the private sector. Janet Lambrew, Deputy Assistant to the President for Health Policy, wrote in a blog. The slowdown has continued even as the economy has strengthened. Jason Furman, chairman of the Council of Economic Advisers, told NBC News. Moreover, the slowdown has been largest in Medicare, which is largely insulated from the overall economy. It is increasingly clear that the Affordable Care Act is one of the many factors contributing to what appears to be a more lasting slowdown in the growth of health costs. But Aaron Catlin, Deputy Director of the National Health Statistics Group at CMS, disagrees. The slowed growth of health care costs looks like what should happen after a recession. It is consistent with what we have seen in past recessionary periods, Kathleen told reporters. In other words, the recession has kept health spending low and people haven't picked up their spending yet, even as the economy recovers slowly. Between 2010, when the Affordable Care Act was signed, and 2012, ACA provisions raised health spending by 0.1%, Martin says. It is a debatable point. Drew Altman of the Kaiser Family Foundation says he believes the he believes the Affordable Care Act has indirectly brought down costs. History tells us that the healthcare market has always responded to the threat. And now, for the first time, also the reality of health reform, he said in a comment, commentary last September. For this reason, it is entirely likely that Obamacare has played an and will continue to play a role in the slowdown in healthcare cost growth and is accelerating market change. Health insurance pays most of the bills, the actuary said. Overall, insurers paid for 72% of all health spending, with private insurers picking up 33% of the tab, Medicare 20% and Medicaid 50%. People paid 917 billion US dollars in health insurance premiums, an increase of 3.2%. And this is next news. Cancer death rates in the US have dropped to 20% in the past 2 decades, thanks largely to less smoking, increased prevention and better detection, a new report finds. The rates have fallen dramatically in some areas, plunging 50% for middle-aged black men, for instance, while barely budging for elderly white women, and disease experts says there is still plenty of room for improvement. Continued within this data are areas of remarkable progress and areas that remain frustrating, said Dr. Clifford A. Hodges, president of the American Society of Clinical Oncology and a chief expert in breast cancer at Memorial Sloan Kettering Cancer Center. An estimated 1.7 million new cancer cases are projected for 2014, including some 586,000 deaths, according to the new report from the American Cancer Society. And cancer remains the second most common cause of death in the US, behind heart disease. The good news in those grim figures is that the rate of death from cancer has fallen from about 25 per every 10,000 people in 1991 to about 17 per 10,000 in 2010. That translates into about 1.3 million cancer deaths avoided, including nearly 953,000 men and nearly 388,000 women.